Assalamualaikum warahmatullahi wabarakatuh. Saadah binti Muhammad Sauki. My PhD title is Investigation of Respiratory Mechanics for Mechanically Ventilated Patient in-depth study of model application. My main supervisor is PMIR Dr. Nusalwada Manhuri. My co-supervisors are Dr. Yong Xiong Chiu and Dr. Belinda Chow Chiu Meng. In December 2019, there is an outbreak of pneumonia disease origin in Wuhan, formerly known as COVID-19, has infected over 1 million people and killed over 1,000 people throughout the world. Generally, COVID-19 often affects the respiratory system that tends to cough and short of breathing, which also can be associated to the respiratory failure. This respiratory failure able to match the idea of acute respiratory distress, ARDS. ARDS is type of respiratory failure and usually characterized as an inflammatory lung reaction which caused by pneumonia or chest injury. ARDS can cause the lung to become inflamed and filled with fluid, which can cause it to be stiffened and possibly collapse due to the additional weight of fluid. ARDS patients who are experiencing short of breath, they require intensive care, which is mechanical ventilator. Mechanical ventilator is used for breathing support. MV therapy is the most common treatment for ARDS patients and respiratory failure patients. MV therapy are used to assist patients who are experiencing respiratory failure. Second is used to help a patient by increasing the requirement and oxygenation and reducing the work of breathing. Third is to prevent additional damage while maintaining adequate gas exchange. During receiving mechanical ventilation therapy, patients may experience asynchronous breathing (AB) when patient breathing is not synchronized with the ventilator support due to the spontaneous breathing effort. However, during receiving the MV therapy, the number of AB may increases, which resulted in poor patient-ventilator interaction, increased work of breathing, and can lead to difficulty in determining the respiratory mechanics of this MV patient. As I mentioned earlier, MV therapy is a common use treatment for ARDS patients with respiratory failure. However, there are several major issues arises during MV therapy. First of all is lack of clinical method. Second is the length of time for ARDS patient using MV. As you know, currently the clinician in hospitals set the MV based on their experience. However, due to the inappropriate ventilator setting, a large scale of clinical trials has failed and have had influence on mortality and morbidity who are using the MV. Therefore, these findings highlight the necessity of having an effective ventilator approach in order to minimize the risk of danger and reduce the mortality in ARDS patients. As you can see from the right-hand side, these are the list of problem statements that has been highlighted in this research. According to the prior research, there are several mathematical models that have been established to help the clinician to choose optimal ventilator setting for the patients. However, the developed models have several limitations, which are: first, the existing model use low number of patient dataset. Second, the models limited only to the SIMV mode, which MV therapy, mechanical ventilation have many mode that can be set. The third problem is that the model cannot be used to the patients who are experiencing asynchronous breathing during receiving the MV therapy. Due to the problem, this research has come out three objectives to overcome the problem. The aim of this research is to investigate and develop a new extended model of respiratory mechanics for ARDS patients by creating model-based measures of the potential impact of changing MV therapy parameters in MV patient. Below are the three objectives to overcome the problems. First is to develop a physiological respiratory model that able to capture the respiratory mechanics of patients during MV therapy. Second is to develop a new method that using deep learning technique in classifying the asynchrony breathing type based on clinical data of MV patient. Third is to validate the models and the application and also analyze the performance of the model. The primary purpose of this research is to provide more relevant information on respiratory mechanics of ARDS patients that varies in different ventilation modes. There are several scopes of work that must be performed in order to obtain the intended output. First is the collection data of MV patient. The information will be gathered from patients that are admitted to the ICU at IIUM Medical Center Kuantan. Second, the data will be collected using the clinical application respiratory elastance care software with a target participant of 20 patients who have respiratory failure and require mechanical ventilation. For model development, this research using MATLAB software and Python software to construct to achieve the first objective and the second objective. To individualize MV therapy with model-based method, it is essential to have a mathematical model that can be applied to analyze respiratory system mechanics in MV patient that is suitable for real-time use at the bedside. Thus, this research aims to capture the respiratory mechanics in depth throughout the days of ventilated patient for ARDS patient. This proposed research can be implemented in real time and easily accessible at the bedside. The ability of this real-time metric will help the clinician to ensure the ventilator setting chosen are optimal for the patient. Third is to improve the efficacy of mechanical ventilation therapy. In recent decades, there are various studies have been performed to estimate respiratory mechanics using the mathematical model in order to achieve appropriate ventilation for MV treatment. This table shows several models that have been developed to estimate respiratory mechanics. Even though all the models shows an interesting result, however, the majority models are created for an educational purposes, and a few have been created with a real-time treatment goal or outcome for a patient specific. However, the existing model use limited good dataset and limits only to SIMV mode, which neglects the other ventilation modes. Therefore, it is very important to develop a model that is able to see more in depth of the patient respiratory mechanics progresses in different ventilation modes during receiving MV treatment. This figure shows the summary flow of the works in this research. To begin with, the data from a pilot clinical trial at the IIUM hospital will be collected. Then the model development. The third is the classification type of asynchronous breathing using deep learning method. And the fourth is the analysis. And the final are the result for model development and the classification type of asynchronous breathing. For the data collection and clinical trials, the data collection will be collected from 20 ICU patients in IIUM hospital. All the patients must be ventilated using Puritan Bennett PB980 ventilator, which the patient must be ventilated in various ventilation mode. The data collection will be performed using care software system as you can see in the right-hand side figure. For the model development part, this research used the time-varying elastance model that established by Chu et al. In order to predict the respiratory elastance of MBV patient. The equation, the EDRS is an extension of respiratory system elastance, ERS, from the equation of the single compartment model. The EDRS, the time-varying elastance model, composed of three subcomponents: cage elastance, elastance demand, respiratory elastance. The equation of EDRS, time-varying elastance model, as you can see here, EDRS equals to ECW plus elang plus E demand. This slide shows the simple compartment model. The ERS is replaced to the EDRS. Next is the classification type of asynchronous breathing using deep learning method. To classify the type of asynchronous breathing, the data will be collected on every patient must be ventilated in various ventilation mode. The classification must be using the deep learning method, and there are various types of asynchronous breathing occur in the MV patient. For the data analysis and validation will be done to ensure the accuracy of the developed respiratory mechanics model. Throughout this research, biostatistical analysis such as median, interquartile range, p-value, and model comparison in order to evaluate the performance of the respiratory mechanics. In the section development model of classification type of asynchronous breathing using deep learning method, the developed model was developed in recognizing and detecting and classify the different types of AB. The developed model was trained using 70% of the training set, and the others 30% was reserved for validation to determine whether the developed model has reached sufficient accuracy. Besides that, the performance also was evaluated using careful cross-validation accuracy due to the classification of several types of AB. This slide displays the comprehensive Gantt chart detailing the entire research process. This slide shows the publication status. This slide shows the status thesis writing. So regarding the upcoming semester schedule, there is ongoing work focused on identifying various types of asynchronous breathing patterns using one-dimensional patient data. This research employs a cascaded approach involving both LSTM and CNN models combined with the RF classifier method. Additionally, work is underway to draft a paper based on the outcomes of this work with the intention of submitting to the Q1 ranked journal CMPB. Thank you.